Do cheek fillers migrate? There's a lot of opinions on this on social media, ranging from accurate to complete nonsense. So I'm going to give you my take based on my 15 years of experience doing cheek fillers. The answer is, it depends. If the correct cheek filler is chosen, if it's injected into the right plane, then the filler should not migrate. So I did a little demo here where I took an appropriate filler and I pretty much emptied one syringe of it onto the cheek. So this shows you a couple things. First of all, that one syringe of filler really isn't that much filler, so this is why you need multiple syringes sometimes to achieve a good look in the cheeks. Second, it shows you that when I push down on the filler and try to move it, it retains its shape and it does not spread. So this filler, when injected into the appropriate layer, should maintain its shape and should resist some degree of stress and migration. So, in what situations does cheek filler migrate? Well, let's look at the layers. You have the skin, you have the superficial fat, muscle, deep fat, and the bone. Actually a little bit more complex than this because you have different fat pad compartments, but I'm trying to keep it simple for you guys. So to provide nice volumization and contouring and definition of the cheeks, on the sides of the cheeks, the filler needs to be injected right on top of the bone. In the middle part of the cheek, we lose those fat pads as we get older. That's what causes the descent of the cheek. So the filler has to be injected deeply and can be used to mimic replacement of those fat pad compartments. Usually most of the filler does integrate into the tissue over time. But if the injection is performed into the incorrect plane, with muscle movement, that filler can be pushed towards the surface. And if you choose a filler that is less resistant to strain, then this increases the possibility of that happening. But migration with cheek filler, should it occur, is usually a localized migration, and the filler has a tendency to get pushed up towards the under eyes. Cheek filler will not migrate from the cheeks to, let's say, the jowls or the lower face. Filler just doesn't migrate that far. So that's my take. Questions, leave them in the comments, and don't forget to follow for more.